Assalamu alaikum, everyone. My name is Reem Nawaagha. I'm the Continuing Professional Development Director at Al Musa Health Group. My advisor is Dr. Ayman Afifi. My project is all about enhancement of nursing students' communication skills with patients and their families. Patient-nurse communication plays an important role to ensure patient safety and service quality. Unfortunately, nursing and other allied health faculty members concentrate on clinical training rather than interprofessional skills of students. And as you know, healthcare providers in hospital are involved with a lot of unexpected situations and different people mentalities. I found many studies which tackle faculty development based on faculty feedback, and none of them were taking faculty and student feedback into consideration while they are preparing a development program of faculties or measuring the impact of faculty trainings on students' performance. This mixed study aims to enhance nursing students' communication skills with patients and their families by identifying faculty members' training needs based on both faculty and students' feedback, conduct faculty training based on the need, and measure the impact on students' performance. What have been done? I started with taking a TOT structured program, then I got my IRP approval and distribute the questionnaires to faculty. I get about 85% response, and for students, I get about 75% response. First, the questionnaire were distributed to the faculty members to measure faculty perception versus performance in reference to competencies and teaching strategies related to communication skills improvement among the students. And second survey were distributed to the students. The second survey have 5 dimensions. First, about the teaching strategies faculty members used at the college, competencies taught to them, students themselves attitude, patients' health status, and clinical trainers' cooperation. In terms of data analysis, this quadrant divided based on the median, and some results fall in area where the training is needed urgently, and some results fall in the training is needed but not required urgently. In terms of the major communication domains, which is required major training or urgent training, is adaptive, interpersonal, and nonverbal communication. When we go more specific to the competencies itself, we found that they fall in the same domains mentioned before, plus speaking and listening skills. And as for the teaching strategies, we found that the most needed is the encouraging the students to reflect back on their own performance using role play, teaching back, and creating learning environment that foster clinical thinking. Followed by construction of communication rubric to measure students' baseline and preparing the videos for training. And this training were provided online through the LMS, and each training is started with the pre-assessment and it end with post-assessment and satisfaction survey. Lesson learned: faculty members believe about their performance were different than how students perceived really this performance. And the more surprising was how students apply them when they show very low performance, especially with family members. That encouraged us to add the semi-structured interviews for more understanding. What's next is the faculty training will be continued, and semi-structured interviews will be also conducted to gather in-depth and more information. Students' formal communication skills course will be conducted based on students' request, and we will measure the outcomes. Thank you for Ain Shams University FAMIR team and Al Musa Health Group and faculty members. This is my references, and thank you very much for listening. If you have any question, I'm ready to answer.